Nancy Zimney, Canine Rehab Therapist at Peak Veterinary Referral Center in Williston, Vermont. The purpose of the video today is to show you how to do passive range of motion of the hind limb on your dog. Exact handholds can vary depending on the size of your dog and also the exact problem for which they're receiving, or they need to have passive range of motion done. But certain basic principles always apply. First, your dog should be as relaxed as possible. Usually that means in the sideline position. Always support the limb and avoid any twisting or torquing of any of the joints. So I've got my hand underneath Harper's leg and supporting him in this position. Use comfortable handholds and move slowly, avoiding any quick or jerky motions, and respect the normal range of motion of the joints, as well as the dog's sensitivity or resistance to movement. And never force a joint beyond the dog's willingness or ability to allow it to move. In the hind limb, there are three major joints. We have the hip, the knee, and the ankle. While it may be important to move each of these joints separately and individually, they can also be moved together, all three at the same time, in an efficient way, in an accordion-like motion. So I'm going to support Harper's leg here. I'm going to put one hand, my left hand, back on his pelvis, and I'm going to sort of collapse him up, fold him up like an accordion into flexion, like that. So he gets bending at his hip, his knee, and his ankle all at the same time. And then I'm going to straighten him out and bring those joints all out into extension at the hip, the knee, and the ankle. So if we do that a few times, I'm just going to bring his hip and knee and ankle into a bent position, and then bring it out, moving slowly and comfortably. And Harper's relaxing really well and allowing me to do these motions. Keeping the leg more or less parallel to the ground in this position. Flexing and extending. Now there's one motion at the hip that doing that accordion-like motion doesn't pick up, and that's hip extension. So we have to add that when we use the accordion-like motion. So again, I'm going to take one hand and put it back here on his pelvis. My other hand is still supporting the limb, but I'm going to move my other hand up to the front of his thigh a little bit, right through here. And then I'm going to extend the hip back through its full available range. If the dog pulls forward like Harper just did, just go with it. And then you can just sort of shake him and jiggle the leg a little bit to get him to relax and bring it back. Okay. So for the accordion motion, if you're going to do all three, it's bringing it up, flexing at the hip, the knee, and you can use your elbow to bend the ankle, bringing the leg down into being straight, but then not forgetting to add separately that hip extension. Jiggling if you need to continue to have the dog relax as much as possible. Okay. Now, depending upon your dog's individual needs, you may need to do passive range of motion of each one of these joints separately. So the hip joint is the most complicated one because there are several directions in which it moves. There's the flexion, which you already saw as part of the accordion motion. One hand on the pelvis. Now I've got my hand behind his thigh and I'm flexing that hip. And the extension, which we just did as an isolated movement. One hand on his pelvis, the other one on the front of his thigh, bringing him back into extension. So for the hip, it would be flexion and extension. Great job, Harper. In addition to flexion and extension of the hip, there's abduction, abduction, which is just bringing the hip into a neutral position, bringing it up, and then back down into adduction. Abduction and adduction. And finally, there's some rotations at the hip. And for this one, usually support the dog's leg, especially a big dog like Harper. Again, just on my forearm and hand. And there's an internal rotation. You don't want to torque the knee joint on this one. So I'm just going to use my forearm really to gently turn the thigh inward for internal rotation. And I can do the opposite for external rotation. Internal rotation and external rotation. Dog with a normal range of motion of joint and external rotation will often be able to just place the leg in this position. Okay, at the knee joint or stifle joint, there's flexion and extension, so bending back. And you can see that the ankle pretty much makes it back normally all the way to their rear end with this bent angle, and then extending out. Okay, so for this one, the hip is kept in a sort of a neutral position. On a big dog like this, one hand under the thigh so the leg doesn't fall down. Pressure against the front of the lower leg to bend the knee, and then back of the ankle to extend. Last joint at the ankle, again, it's basically flexion and extension. For this one, the knee should be flexed to start with. So we've got Harper at about a 90-degree angle of his knee joint bent, and we're going to keep him there while we move the ankle up into flexion and then extension. Flexion and extension. Good. And of course there are the joints in the paw, but we'll be doing those in a separate video.